Hey there, it's Dr. Jim. Thanks for stopping by and watching my video. I have a good topic for you because it might actually help you out or help someone you know. How healthcare professionals and caregivers can deal with long haul COVID. I've been reading about this a lot. I know many people who they haven't heard about long haul COVID, and yet some of them are experiencing symptoms related to it. So maybe you've been vaccinated once, twice, maybe even 3 times boosted, and you were ill, and then you got over the illness, and now months later, you're starting to experience lingering health issues like brain fog, fatigue, loss of smell, loss of taste, things like that. You and millions of other people actually may have long haul COVID. So, what can you do to help yourself? Let's take a look at some of the symptoms here. Symptoms of long haul COVID. You haven't experienced these before, perhaps never in your life, or you have before, but now these symptoms are exacerbated, they're worse. They include symptoms like fatigue, depression, sleep problems, anxiety, mood changes, trauma, muscle pain or soreness that you didn't have before, nonspecific chest pain, heart palpitations, lightheadedness, dizziness, breathlessness. Some people complain about brain fog and even memory problems. So these symptoms might be very subtle, almost unnoticeable for certain individuals. Some may be frustrated or agitated because they are experiencing moderate syndromes. And still, other people may have very severe to profound symptoms, which cause them a lot of distress and a decline in their work life and in their family life. So we do have to take these things seriously. Everybody that I know, everybody probably that you know, has been affected by COVID in one way, shape, or form. Now, according to all the latest research that I've been reading, if you were hospitalized for severe COVID, if you were in the ICU for an extended period of time, and in particular, if you were on ventilator care, then you might be very susceptible to developing long haul COVID symptoms. And in particular, depression, anxiety, and even PTSD. So, why am I talking about this? If you're a healthcare professional, a professional caregiver, an informal caregiver, and actually this affects just about anyone in any industry out there, the very nature of your work putting you into close contact with individuals who may have had COVID, spending all of that time in healthcare settings may have put you at risk of being infected yourself. And now, tens of thousands of healthcare professionals who work in hospitals, nursing homes, assisted living, home health, hospice, all these places are at greater risk of developing long haul COVID. You went through the illness once, you got over it, but now these symptoms are coming back. They're creeping back into your life. And because women dominate healthcare still, it seems that the greatest numbers of individuals affected by long haul COVID are middle-aged women or females working in healthcare. So there you have it. Many healthcare professionals and caregivers complain about an onset of new health concerns, new symptoms that they have not had before. And they feel greater and more frequent fatigue, for instance. They complain that their memory isn't as good as it used to be. They experience things like lightheadedness, tightness in their chest, breathlessness, dizziness, all of these things. And while there may be other reasons, I'm not saying this is all long haul COVID. There could be a lot of underlying conditions. related to those symptoms. But we are learning more and more that many of these symptoms may be associated with long haul COVID. So, what can be done? I read the literature. What are we going to do? Do we just deal with it? Do we just, wait it out? But particularly for people working in healthcare and who have already gone through one of the most traumatic experiences in their career, being told that they have a new condition called long haul COVID, or you're a long hauler, or this is a post COVID syndrome, that's a hard pill to swallow. And it could be even worse than that. It might actually re-traumatize people, like, oh, I have to go through all of that again, or it could be worse this time, or my symptoms are going to last how long? This is a terrible thing. Well, thankfully, there are things that can be done to deal with the symptoms associated with long haul COVID and ways to move towards a healthier future. Experts and everything that I've read are recommending the following. Okay, these are important. First of all, always start with seeking medical help. Go to your family practitioner, your family doctor. Effective treatments begin with accurate diagnostics. So go to your family doctor or get a referral to what are now called post-COVID departments in numerous hospitals around the country. It's important to rule out any underlying health condition and actually confirm a diagnosis of long-haul COVID. Number 2 is seek out specialists. You may need someone more than your family practitioner, or going to a post-COVID unit in a hospital. Depending upon your symptoms, how long you've had them, the severity, and everything else, specialists might need to be consulted. We're talking about cardiologists, neurologists, psychologists, pulmonologists, infectious disease physicians. This way, you'll get more targeted care and you will get more specialized care. And that's extremely important when it comes to long haul COVID. Third, continue to work and practice with caution. Universal precautions are still something that we should be doing every single day. Using personal protective equipment if you have to. Engaging in good hand washing practices, using hand sanitizer with at least 60% alcohol. And of course, to encourage your colleagues and your coworkers to do the same. Now, maybe you're not experiencing physical long-haul COVID symptoms. You're experiencing mental health or emotional distress type disorders. We're talking about depression, anxiety, maybe PTSD. The fourth thing to do is to take those very seriously. Depression, left untreated, can lead to very terrible things. Same thing with anxiety disorders, panic disorders, post-traumatic stress disorders. There are experts out there that can help you with these things. They know about this. They know that, particularly healthcare professionals, those frontline workers out there, they went through hell for 2 years, and it was bound to carry some type of toll with it, right? Fifth, manage your stress. This might sound very difficult. I understand it, but it's necessary to get better and to move forward. Try very simple, practical methods, like deep breathing. Deep breathing goes like this. It's so simple, okay? You're going to breathe through your nose. Inhale through your nose, count to 4. Exhale through your mouth, count to 4. Do that 4 or 5 times, 6 times, and it really does calm you down. It's a really good thing to do. Find a quiet place to regroup. Reach out to friends and colleagues. And if you can, take a little time off if you need it. Number 6, get rest. The body heals best when it's in a state of rest, relaxation, and particularly good quality sleep. Resting doesn't mean staying up, watching TV for hours, binging on whatever show, munching on chips and, eating ice cream and all these other things. That's not rest. True rest involves activating your body's natural relaxation response that lowers heart rate, blood pressure, and stress or anxiety. Now you're in a state of relaxation. Number 7, exercise. That's always important to move around. And I know this might sound counterintuitive, but moving around is much better than sitting still when you're experiencing things like pain or fatigue. Activity boosts energy, but this comes with a caveat. Be sure not to overdo it. Don't push yourself to the limits. Instead, set realistic and modest goals. Okay? Now, other ways to engage in self-care and promote healing during long haul COVID. Eat a healthy diet, anti-inflammatory, balanced, stay hydrated, limit alcohol and caffeine. If you do smoke, it's recommended that you quit. Find support, practice mindfulness, pray, meditate, and find other people around you who can help you get through these difficult times. Here are my final thoughts. COVID-19 has affected millions of people around the United States and around the entire world. Healthcare professionals and caregivers working in the front, you were at risk for infection and a myriad of other issues, health, mental, emotional, and so on. Now, we're finding that people are dealing with mental and physical symptoms that they never, ever had before. Long haul COVID is real, and it's causing what some experts are calling the next pandemic. Thankfully, there are things that can be done. There are ways to help yourself and others. And always remember, you're never alone when it comes to dealing with long haul COVID symptoms. There are people who can help. Thank you for listening. I'm Dr. Jim Collins. Keep coming back for more good information. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description and keep coming back for more information. I hope to see you soon.